All right, so we're going to dive into something that's been kind of all over the news
Hmm.
lately, avian flu,
Yeah.
or more specifically, the H5N9 strain of avian flu.
Right.
And this is a rare one, and the
It's
fact that it just showed up in the U.S. for the first time ever has gotten a lot of people asking questions.
Yeah, it's definitely concerning.
So, we're gonna unpack some research and reports on this outbreak today, and I've got an expert here with me to kind of help us make sense of it all.
Absolutely happy to be here.
So we'll look at the economic side of things, the impact on wildlife, and of course the big question, what does it mean for human health?
Right, the big one.
Yeah. So I think you'll find this deep dive pretty eye-opening, especially if you've ever wondered why, bird flu should even be on your radar.
Yeah, I think it's easy to think that this is just a bird problem, you know,
Right.
but it really goes way deeper than that.
Yeah.
And I think this California outbreak is a little bit of a canary in a coal mine
Okay.
for some potential bigger issues with infectious diseases in general.
So let's start with what happened in California.
Okay.
On December 2nd, 2023,
Mm.
a duck farm in Merced County found themselves dealing with an outbreak.
Oh, wow.
We're talking 119,000 birds.
Wow.
And not just any strain of avian flu. They found both H5N9
Oh, wow.
and the more familiar H5N1.
Yeah.
Sadly, the entire flock had to be culled to
Yeah.
contain the situation.
Of course.
And you know what I find interesting is that they found two different strains at the same farm.
Yeah.
Does that tell us anything about how these viruses work?
Yeah, it definitely raises some interesting questions about the dynamics of these viruses.
Okay.
To understand why finding two strains together is significant,
Yeah.
we need a bit of context.
Okay.
Avian flu in general has been a global concern for over 2 decades.
Wow.
H5N1, the one that, often makes the news,
Right. Right.
first appeared in humans back in 1997.
Yeah.
It's caused massive losses in poultry and, unfortunately, some human fatalities.
Yeah.
Too often with a very high fatality rate.
Right.
But H5N1 isn't the only player we've seen other outbreaks caused by different strains like H7N9 in China
Right.
and H5N8 in Europe and Asia.
Yeah.
So this really highlights how adaptable these viruses can be.
Yeah.
And finding two strains together in this outbreak, it suggests that they may be interacting or even swapping genetic material,
Oh.
which could lead to, new, potentially more dangerous strains emerging.
That's pretty unsettling.
It is.
And I know this isn't just about the birds themselves. The economic impact of these outbreaks is huge.
Right. Globally, avian flu outbreaks have caused billions of dollars in losses.
Really?
Yeah, we're talking about the cost of culling trade restrictions getting put in place, disruptions to the entire poultry supply chain.
Wow.
Imagine the ripple effect if something like the global coffee industry were suddenly disrupted. That's the kind of scale we're talking about.
Wow, that puts it into perspective. And beyond the economic hit, I imagine there's an ecological angle to this as well.
Yes, there are serious environmental concerns.
Okay.
Migratory birds, which are, vital for biodiversity, play a key role in spreading avian flu across continents.
Right.
So it's not just about protecting poultry farms. Wild bird populations are also being impacted by these outbreaks.
Yeah.
We're seeing die-offs in various species, and that can disrupt entire ecosystems.
So we've touched on the economic and the environmental impact of these outbreaks.
Right.
But I think the question on everyone's mind is, what's the risk to human health?
That's the key question, and it's important to address it head on.
Mm-hmm.
The good news is most avian flu viruses don't infect humans.
Okay.
That's why we haven't seen, widespread human transmission with most strains.
Okay. That's reassuring, but I know there have been cases where avian flu has jumped from birds to humans.
You're right. Some strains, particularly H5N1 and H7N9, have shown the ability to infect humans. And that's where the real concern lies, is these viruses have the potential to cause a pandemic if they mutate in a way that allows them to spread easily from person to person.
So that brings us back to this new H5N9 strain.
Right.
It's so rare. So why is it showing up in the U.S. now? What's going on there?
Well, influenza viruses are constantly evolving and mutating.
Yeah.
And that's what makes them so challenging to control.
Mm-hmm.
H5N9's appearance in the U.S., where it's never been detected before, raises a lot of questions.
Yeah. Like what?
Like, is its host range, meaning the type of animals it can infect?
Yeah.
Is that expanding? Could
Ah,
this be a sign that it's adapting to infect mammals more efficiently, including potentially humans?
I see. So the fact that it's here at all is kind of a red flag.
Exactly. And then there's the question of transmissibility.
Right.
Is becoming more easily spread between birds?
Okay.
If so, that would also increase the risk of it jumping to humans.
Right.
And perhaps the most concerning question is, could H5N9 evolve to resist our current antiviral drugs? If that happened, our treatment options would be severely limited.
So how does H5N9 compare to the more infamous H5N1 in terms of risk?
H5N1 has a pretty scary track record.
Yeah.
It's highly pathogenic, meaning it causes severe illness in birds,
Right.
and it has a history of infecting humans, sometimes with deadly consequences.
Right.
We know less about H5N9,
Yeah.
but its genetic similarities to other H5 strains,
Mhm.
particularly the possibility that it emerged by combining with other H5 viruses,
Hmm.
makes it a serious concern.
Okay.
It suggests that it could possess some of the same dangerous characteristics as H5N1.
So managing this isn't as easy as just telling people to wash their hands more often, is it?
Not at all. This is a complex challenge on multiple levels.
Okay.
Avian flu spreads through various routes, bird-to-bird contact,
Uh-huh.
contaminated equipment, even through the air.
Wow.
And wild birds, which can carry the virus without showing symptoms,
Yeah.
act as a constantly moving reservoir,
Oh, wow.
making containment extremely difficult. We also have limitations in our surveillance systems.
Yeah.
It's hard to track these outbreaks effectively, especially in wild bird populations.
So are there any effective strategies to combat avian flu given all these challenges?
There are several approaches being used, but they all come with their own set of hurdles.
Such as?
Vaccination, for instance, plays an important role in some areas, but it's not a foolproof solution.
I know there are different types of flu vaccines. Do the ones for humans work against avian flu?
No, unfortunately not. And even the vaccines specifically designed for poultry have their limitations.
Oh.
Current vaccines are what we call strain-specific,
Mm-hmm.
meaning they only offer protection against a particular strain of avian flu.
Okay.
If a new strain emerges or an existing one mutates significantly,
Right.
the vaccine might not be effective.
I see. So it's like playing catch up with a moving target.
Exactly. And we can't forget about the cost of vaccination,
Yeah.
which can be a major barrier for small farmers who may not be able to afford it. And then there's the issue of trade. Some countries have restrictions on importing vaccinated poultry, which adds another layer of complexity.
So given all that, what's the current thinking on the zoonotic threat, the possibility of humans getting infected?
While human infection with avian flu is still relatively rare, it's important to remember that when it does occur,
Mm-hmm.
the consequences can be very serious.
And what are the factors that increase that risk of human infection?
There are three key factors that contribute to the risk. First, you have viral mutations
Okay.
that make it easier for the virus to bind to human cells, essentially allowing it to gain a foothold in our bodies.
Hmm.
Second, you have close contact between birds and people,
Right.
which is often the case in crowded poultry farms or live animal markets where hygiene standards may be lacking.
Yeah.
And finally, you have global travel,
Right.
which can quickly transport an infected person across vast distances, potentially seeding new outbreaks in far-flung locations.
It's a sobering reality given these challenges. Are the current efforts to combat avian flu actually making any headway?
There's definitely a lot of work being done, and I think we are making progress in several areas.
Okay, like what?
For example, there's a big push to enhance surveillance efforts.
Okay.
This includes monitoring wild bird populations more closely for signs of infection,
Mm-hmm.
constantly analyzing the virus's genes to look for dangerous changes,
Uh-huh.
and improving global collaboration and data sharing so we can track these viruses more effectively.
So it sounds like we're getting better at spotting these threats early on. What about treatment and prevention? Is there any research happening on that front?
Absolutely. There are exciting developments in research as well.
Okay.
Scientists are working tirelessly to develop a broad-spectrum vaccine
Mm-hmm.
that could offer protection against multiple strains of avian flu.
Wow.
That would be a game changer in terms of prevention.
Yeah.
They're also researching new antiviral drugs that could be more effective in treating avian flu infections in humans.
So there's a sense of urgency, but it sounds like there are some promising leads being pursued. What else is being done to get ahead of this?
Technology is also playing an increasingly important role. Researchers are exploring the use of artificial intelligence to predict outbreaks before they even happen.
Really?
Yeah, using data on things like bird migration patterns, climate conditions,
Wow.
and even social media activity to identify potential hotspots.
That's fascinating. Using AI to predict outbreaks sounds like something straight out of a sci-fi movie. What about the policy side of things? Are governments doing enough to prepare for potential pandemics?
It's an ongoing process, but there's definitely a growing recognition that governments need to have solid plans in place for responding to outbreaks.
Like what kinds of things?
This includes things like stockpiling antiviral drugs and personal protective equipment,
Mm-hmm.
developing clear protocols for quarantine and isolation,
Mm-hmm.
and ensuring healthcare systems are equipped to handle a surge in cases.
It sounds like a huge undertaking.
It is, but it's absolutely essential. Public education is another critical component.
Okay.
We all need to know the basics of biosecurity, such as proper hygiene practices and how to avoid contact with sick birds to protect ourselves and our communities.
So individual actions can make a difference? What about the economic side? How are trade policies being adapted to address avian flu while still supporting the poultry industry?
That's a tricky balance to strike.
Yeah.
Trade policies need to be designed in a way that minimizes the risk of spreading the virus while still allowing for the flow of goods and services.
Right.
This might involve things like stricter import regulations, enhanced testing of poultry products, and better communication between countries about outbreaks.
It sounds like a complex web of interconnected challenges. What stands out to you as the most pressing issue that needs to be addressed?
I think one of the most crucial aspects is improving global collaboration and data sharing.
Okay.
Avian flu is a global problem that requires a global solution.
Mm-hmm.
We need countries to work together to track the virus, share information about outbreaks, and coordinate research efforts.
That makes sense. A virus doesn't respect borders, so we need to be working together to fight it. Exactly. We're all in this together, and a coordinated global response is essential to effectively combat avian flu.
So this H5N9 outbreak might seem like a distant problem to some people,
Yeah,
but it really underscores how interconnected our world is.
right.
A virus emerging in one part of the world can quickly become a global threat.
Absolutely.
So what does this all mean for our listeners?
Right.
What can they do in their daily lives to be more aware of and prepared for emerging health threats like this?
That's such a crucial question.
Yeah.
And I'm glad you brought it up. While scientific advancements and policy measures are vital, individual awareness and preparedness are equally important. We can all play a role in minimizing the risks.
Okay, so let's talk about that. What are some practical steps people can take?
First and foremost, stay informed.
Okay.
Keep up with reliable sources of information about emerging health threats, like the World Health Organization or the Centers for Disease Control and Prevention.
So basically, don't rely on social media for your health news.
Exactly. While social media can be a useful tool for sharing information.
It's also a breeding ground for misinformation.
Yeah,
Stick to reputable sources that are grounded in scientific evidence.
good advice. What else can people do?
Practice good hygiene.
Okay.
This might seem basic,
Yeah.
but it's incredibly effective in preventing the spread of infectious diseases. Wash your hands frequently with soap and water, especially after being in public places or handling raw poultry.
Right.
Avoid touching your face, and if you're coughing or sneezing, cover your mouth and nose with a tissue or your elbow.
Those are good habits to have, regardless of whether there's an outbreak or not.
Absolutely, and if you're traveling, be mindful of your surroundings.
Oh, okay.
Avoid contact with live poultry or wild birds, especially in areas where avian flu is known to be circulating. And when you return home, be sure to wash your hands thoroughly and monitor your health for any signs of illness.
It sounds like common sense, but it's easy to forget these things when you're caught up in the excitement of travel.
That's why it's so important to be aware and prepared. Another thing to consider is your food choices. Make sure poultry and eggs are cooked thoroughly to kill any potential viruses.
So no more sunny side-up eggs.
It's best to err on the side of caution, especially during an outbreak.
Okay, so we've covered hygiene, travel precautions, and food safety. What about protecting pets? I know some people have backyard chickens or pet birds.
That's a good point. If you have birds as pets, keep them indoors and separated from wild birds. Make sure their food and water sources are clean and protected. And if you notice any signs of illness in your birds, contact a veterinarian immediately.
So being proactive and taking these preventive measures can really make a difference in protecting ourselves and our communities. What about if someone does get sick? What should they do?
If you experience any flu-like symptoms, such as fever, cough, sore throat, or muscle aches, especially if you've had recent contact with birds,
Right.
it's essential to seek medical attention. Promptly let your doctor know about any potential exposure you may have had.
Early detection is key, right?
Absolutely. Early diagnosis and treatment can significantly improve outcomes, especially with severe cases of avian flu. There are antiviral medications available that can help reduce the severity and duration of the illness.
So it's important not to ignore those symptoms and get checked out right away. Is there anything else people should be aware of in terms of treatment options?
Yes, there's been a lot of discussion about the development of new antiviral drugs and vaccines.
Hmm.
While there are currently no vaccines specifically for H5N9, scientists are working on it.
So there's hope on the horizon, but it sounds like the best defense right now is really prevention and early intervention.
That's right. We can't afford to be complacent. Avian flu is a serious threat,
Yeah.
and it's one that we need to take seriously.
I think this deep dive has really highlighted the importance of staying informed and being proactive when it comes to emerging health threats. We've learned about the science behind avian flu, the risks it poses, and the steps we can all take to protect ourselves and our communities.
You've summed it up perfectly.
Mm.
It's about being aware, prepared, and resilient.
This H5N9 outbreak serves as a stark reminder that in our interconnected world, a health threat anywhere can quickly become a health threat everywhere. But by understanding the risks and taking appropriate precautions, we can all play a part in mitigating those risks and building a healthier future for ourselves and generations to come.
Well said. We have the knowledge and the tools to face these challenges, and by working together, we can overcome them.
Yeah, it's been a fascinating and honestly a little bit unnerving
Yeah.
exploration of avian flu and the emergence of this new H5N9 strain.
Right.
I think we've covered a lot of ground today, from the science behind these viruses
Hmm.
to the practical steps we can take to protect ourselves.
Absolutely. And I hope our listeners are walking away with a better understanding of the complexities of this issue.
Right.
It's not just about birds.
Right.
It's about global health,
Yeah.
the environment,
Mm-hmm.
economics,
Yeah.
and our individual responsibility in navigating these challenges.
Yeah. Absolutely. What I find particularly striking is how interconnected everything is.
Yeah.
A virus emerging on, a duck farm in California
Right.
can have ripple effects across the world,
Mhm.
impacting human health,
Yep.
trade, and even the delicate balance of our ecosystems.
Yeah, it really highlights the need for a global perspective and a collaborative approach to tackling these kinds of threats. We're all in this together,
Yeah.
and we need to work together to find solutions.
I think one of the key takeaways for me is that knowledge is power.
Absolutely.
The more we understand about these viruses, how they spread, and the potential risks they pose, the
Mhm.
better equipped we are to make informed decisions and take appropriate actions.
I completely agree. And it's not just about understanding the science, it's about being aware of the resources available to us.
Right.
Like the World Health Organization and the Centers for Disease Control and Prevention that provide reliable information and guidance.
Right. We can't just bury our heads in the sand and hope these threats go away. We need to be proactive, stay informed,
Mhm.
and take those everyday preventive measures like good hygiene and responsible travel habits.
Right.
That can make a real difference.
And it's important to remember that this is an evolving situation.
Right.
New information is constantly emerging,
Right.
and it's crucial to stay updated and adapt our behaviors accordingly. Don't be afraid to ask questions, seek clarification, and consult with healthcare professionals if you have any concerns.
So to wrap things up, what's the one key message you would leave our listeners with today?
Stay vigilant, but don't panic. Avian flu is a serious threat,
Mm-hmm.
but it's one we can manage if we approach it with knowledge, awareness, and a sense of collective responsibility.
Well said. This has been a deep dive into the world of avian flu, and I hope you found it insightful and hopefully a little bit empowering.
I hope so too.
Remember, in a world facing ever-evolving health challenges, knowledge, awareness, and preparedness are our most powerful tools.